I, as an osteopath, studied for 4 years. I studied pain, injury, and how your lifestyle and movement relates to your pain and injury. Throughout this video, we'll be following Jack, who's a 22-year-old patient who came to the clinic a few days ago suffering from shoulder pain. Beforehand, we've clarified that he's an accountant who works for around 40 to 45 hours a week, but he's also an avid gym goer, and this itself has its own consequences. So sit back, relax, and watch how I, as an osteopath, deal with Jack's pain and how his movements and lifestyle relate to his pain and injury. Right, Jack, how can I help you today?
So basically I've been having problems with my right shoulder.
Yeah.
It's kind of been an ongoing problem.
Where's the shoulder pain?
It tends to be sort of at the front, so my sort of front delt, and the pain sort of goes into my arm.
Okay. How far down your arm?
It runs up my neck as well. Pardon?
How far down does it go?
I'd say sort of about halfway down.
Yeah.
It feels like sort of just underneath my bicep.
So when you're at the gym, what does make it worse?
It's generally pressing movements.
Pressing above the head or?
It tends to be sort of bench press. I get some problems there, and I kind of sort of have to wiggle around with my grip, how well my grip is. So
we've clarified that pushing movements exaggerate Jack's pain. This, to me as an osteopath, means that a certain part of the shoulder is compromised in comparison to if he said that pulling movements aggravated his pain. Passenger discomfort, you know, it's worse first thing in the morning.
It's always worse first thing in the morning. Okay. A lot of times if I were to go and try and train in the morning, I wouldn't be able to do what I normally do in the evening.
Pain is often worse first thing in the morning. This, to me as an osteopath, means that it's either something wrong with his bed, or more commonly, that an inflammatory reaction is present, i.e. when you're resting for a long period of time, the inflammation doesn't get stirred around, so it just settles in one place, giving you pain. Any problems with your heart before? Any chest pain? Any high blood pressure, cholesterol?
No.
Good. Any problems with your breathing, i.e. shortness of breath, wheezing, coughing?
No.
Great. I now have enough information to make a thorough investigation. I have my hypothesis to what is causing Jack's pain. It's now just down to me to investigate. It sounds like it's nothing serious. The fact that you're having pain in the front of your shoulder and you're getting some radiation down to the front indicates that it might be something to do with your rotator cuff, your biceps, or something a little bit deeper inside the shoulder joint. But when I come back in after you get changed, we'll go through a few tests and I'll tell you what's going on. Right. Great. Jack, before we get on to the examinations that I was telling you about, do you mind if I just take a quick sketch of your posture?
Yep.
It's just to see where your shoulder lies on your body. Okay. Jack, do you mind if I just have a quick feel of your shoulder?
Yeah.
I just need you to tell me if anything's uncomfortable at all. So if you just turn the face that way for me.
It was quite tight in there.
In this area?
Yeah.
Now, when I press into here, do you get any sensation going down your arm?
Yeah.
Okay.
More so for just the front of my shoulder.
So when I press here, you feel the sensation at the front of your shoulder? You can turn and face me. I'd like to just go through a few tests, okay? So if you can take your arms out to the side. Good. Now, don't let me push your arms down. Is that alright? Any pain at all?
No, it's okay.
If you turn your thumbs up, good, or your hands up, and once again push up.
Okay, that feels quite sort of
Good. And push in, please.
Yeah, that's quite sore.
Okay. Down on the other side. Good, and again on the other side. Good. Okay, great. That's the end of the examination. I can now conclude that one particular rotator cuff muscle is causing Jack more problems than the others, and this is the reason why he's getting the radiations of pain down the front of his arm. The examinations that you saw me conduct, i.e. when I'm asking Jack to push down and push in and push out, etc., they also help me specify which muscle in particular is causing Jack pain. If we then look to the other movements that I asked Jack to perform, i.e. when he's on all fours, we can see that his lower back is compensating for a poor upper back and shoulder mobility. This is how his movements relate to his injury. We then relate this to the fact that Jack's sitting down for a long period of time, and we can see why this is happening, i.e. he's sitting down for a long period of time, therefore he's not really challenging his spine's ability to move upright. As well as his shoulder, it's not challenging the ability for it to move back because he's constantly at a desk. Now, it's all well and good me knowing this, but first of all, I need to put Jack at ease. Most of the injuries that you come to the clinic with aren't anywhere near as severe as you think they are. Therefore, when you have a professional put you at ease, it's one of the best interventions that we can give you. Alright, Jack, what you've got is just a slightly tight muscle in your shoulder that's giving you a little bit of aggravation when you're going through the press-ups. The reason why this is happening is just because your shoulder slightly slants forward.
Yeah.
So rather than being in a nice supported position here
Yeah.
when you're benching, meaning all the other supporting muscles are nice and active, it means you're just slightly overloading a portion of your shoulder when it's in this position.
Okay.
Okay. Our aim of the treatment is to relax off the muscle that's giving you some aggravation,
Yeah.
but also help to encourage the stabilising muscles to fix your shoulder in this place
Yeah.
a bit more efficiently. And as well as that, just work a little bit in your upper back to make
Okay.
sure that you can perform what we call extension.
Yeah.
Okay. You might take around 3 treatments to recover, but probably no more than that, okay?
Okay.
What will make the difference is the amount of time that you dedicate to the exercises I'll give you.
Okay.
The more time you dedicate to the exercises, the quicker you recover.
Okay.
Alright?
Thank
you. Next is the treatment. Here we first of all address the site of injury, i.e. the muscle of the rotator cuff. Then we release or relax the muscles in the shoulder that are causing Jack's shoulder to come forward and his spine to arch. So has this been quite a hindrance, like when you go to the gym?
To be honest, yeah, it's stopped me lifting as heavy as I'd like to.
After this, once we've given Jack some symptomatic relief, i.e. pain relief, we can move on to the exercises that are 1, going to help him manage his pain, but 2, help to correct the predispositions that are causing him pain in the first place.
How do you feel?
If you can just give
So,
your
yeah,
shoulder a good move around.
Actually feels a lot looser after that.
Okay.
Feels like there's a lot less strain going through the front, and
Alright.
just generally my shoulder feels a lot more relaxed.
Alright, fantastic. What our priority is now is to just maintain that
Okay.
and make sure that you continue the progress with your own exercises, okay? So I'm going to take you through those now. Good, hold it for a second, and back down. And again.
Yeah.
Hold for a second, and back down. Good, and one more. Good, and do you feel the shrug of the shoulder blade?
Yeah.
Good, and back down. And up. Good, and back down. And up. That's it. Chest up. Good, and down. And what you really want to do is just become a little bit more fluent each time. Good. One more. Good, and back down. So if you perform these exercises once daily,
Yeah.
I'll send you all the instructions via email for each
Okay.
exercise. Ice the shoulder as soon as you get in for 20 minutes per hour
Yeah.
for 3 hours.
Okay.
As well as that, stay away from any heavy press work,
Yeah.
especially wide grip,
Okay.
just to offload the shoulder and give it time to recover.
Okay.
I'll see you in a week's time. You shouldn't take longer than 2 to 3 treatments to fully recover.
Okay.
Sorry?
Yep. Thank
Good
you.
stuff. You're welcome. And that's it. We've addressed the muscle or the area that's causing Jack pain, the movements that are predisposing his injury, as well as his lifestyle implications, i.e. trying to get him moving more whilst he's sitting at the desk to make sure that he's not predisposing himself to movement problems. I hope you've enjoyed our short video today. If you have any further questions, please don't hesitate to contact us via the details below. Don't forget to subscribe to our YouTube channel.